Hey everyone, Alex from O'Brien here. In my last video, I went through the steps of making a tooth-supported surgical guide, and in this video, I'm going to talk about tissue-supported guides for completely edentulous patients. To get started, you'll need a denture with radiographic markers, and this can be done in a couple of ways. If you're making a duplicate denture, the lab can process radiographic markers into the acrylic. The other option is to purchase radiographic marker stickers that can be applied directly to the patient's current denture. You can purchase these from SureMark at the link provided on this page. And 3 to 4 markers placed randomly on the denture will be enough. You'll need to take 2 separate CBCT scans with the denture. One scan is taken with the patient wearing the denture, and the other scan is taken of the denture only, which will be the template for our guide. When taking the scan of the denture, it should be resting on foam, and it should be in the same orientation that it would be if it were in the patient's mouth. Now, these guides do not require impressions or models of the patient's arch, just the CBCT scans. The CT files can be sent to us through our upload portal at the link below, or you can send them on any storage media, including a flash drive or DVD. When sending us prescriptions for the case, let us know your preferred implant brand as well as the number of implants you want. We'll also want to know the restorative plan for the case so that we can identify any issues that might compromise the desired outcome. Once we have everything, our first step is to import the scan files into our planning software and prepare them for use. First, we need to prepare the scan of the denture by isolating the denture from the foam. And the reason to rest the denture on foam is that foam has an extremely low density compared to denture acrylic. With the software, we're able to isolate the data based on its density, which allows us to remove the foam and just see the denture. We can then align the denture scan with the scan of the patient by matching up the radiographic markers. After the alignment is complete, we'll set the panoramic curve. And setting this curve creates a path that the system will use when moving through slices of the image. Next, if we're working with the mandibular arch, we'll locate the mental foramen and we'll map the inferior alveolar nerve. We map the nerve by moving through slices of the data until the canal is revealed, and then we place points along the nerve path as we continue to move through the slices. After the nerve has been completely mapped, it'll show up in the 3D rendering of the data. At this point, we're ready to start the preliminary planning. We'll begin with the implant brand that you specified, and we'll choose a diameter and length that appears to best fit the space. If we see any issues such as inadequate bone or limited space, we'll create a comment which will be included in the preliminary report. We'll also add anchor pins to the guide to help stabilize it while the implants are being placed. If there's room, we'll always try to add 3 pins, but in some situations, we may only have space for 2. When we're finished with the preliminary plan, we'll contact you to let you know the case is ready for you to do the final planning. We'll set up a time for you to log in and remotely control the design software, which will allow you to adjust the placement of the implants, as well as make any desired changes to the diameters and lengths. Once you've completed the implant planning, we'll send you a final surgical report, which you will need to sign and return. At this point, the acrylic guide will be printed, the master sleeves will be added, and the case will be delivered to your office. I hope you found this video helpful, and as always, feel free to contact us with any questions. See you next time.